our phones, they've really become these powerful tools for our health, haven't they?
Absolutely.
Offering everything from managing serious conditions to just, nudging us towards healthier habits.
Yeah.
But actually designing these mobile health systems, these mHealth systems, it's not straightforward.
No, it really isn't.
In fact, quite a few of them kind of struggle to, well, truly help the people they're actually built for.
Exactly. And I think the core issue often it's this lack of real user involvement. There's a disconnect.
A disconnect from how healthcare actually works on the ground.
Precisely. And that's where this idea of co-design comes in. It's about seeing users as, well, the experts of their own lives.
Right. Giving them an active seat at the table.
An active central role in actually creating the solutions.
So today we're doing a deep dive into a really interesting study that tackles this head on. It's called Using Co-Design in Mobile Health System Development, a qualitative study with experts. And our mission, really, is to pull out those key insights, the actionable stuff that can help make mHealth truly effective, truly user-centered for you listening.
Sounds good.
Okay, so we know health design is complex,
Yeah.
but what's maybe the biggest hurdle people face, and how does this particular research light the way?
Well, what's really fascinating, I think, is that the study makes it clear it's not just about coding an app.
Right, not just the tech.
No,
Yeah.
it's about bridging this gap between, technology and really personal, sometimes quite sensitive health behavior.
That human element.
Exactly. And this research, it takes a pretty well-known co-design framework, but it doesn't just apply, it actually tailors it specifically for mHealth. It adds two really critical dedicated phases.
Okay, what are those?
So first, there's a separate prototyping phase that happens before you even get to evaluation.
Before evaluation. Why is that distinction important?
It's crucial because it separates out the early rough ideas, low fidelity stuff like sketches from the more developed high fidelity prototypes, the things that look and feel closer to the final product. Like one expert in the study said, you go from low fidelity to high fidelity and then to user testing. It's a progression.
Got it. And the second phase?
The second is a distinct implementation phase that comes after the evaluation.
So post-testing.
Yes.
Yeah.
This is all about the real world stuff. Rolling it out, documentation, training people, fitting it into these often really complex health systems.
Integrating it properly.
Exactly. Another expert really stressed having implementation on the agenda right from the initial co-design process. You can't tack it on at the end.
That makes so much sense. So it's not just about designing the app in isolation, but considering that whole ecosystem, how it lands in people's actual lives and workflows.
Absolutely. You've got to think about the whole journey. Skipping or rushing that prototyping, for example, it often leads to systems that look good on paper but just don't work in practice.
Because they haven't really been shaped by that back and forth with users.
Precisely. It's like designing a car without ever letting someone test drive it on actual roads.
Okay, so we have this framework. Distinct prototyping, distinct implementation. How does that translate into practical advice? What do the experts say designers need to do?
Right. So the study synthesized insights from these experts into 7 guidelines, but we can kind of group them into 3 main themes.
Okay.
The first one is really fundamental, understanding the human element.
The people involved.
Yes. You absolutely have to get a handle on stakeholder vulnerabilities, their diversity. Health stuff is deeply personal.
Yeah, it can be hard to talk about.
For sure. One expert mentioned the challenge of getting people to open up and be honest about their experiences. And it also means having really empathetic facilitators for the co-design sessions. People who can handle tricky power dynamics.
Like between a patient and their doctor.
Exactly. That came up explicitly. Someone noted that power balance is particularly interesting in healthcare. You need facilitators skilled in navigating that.
That's such a key point. It's about trust, connection, not just code. Okay, what's the next theme?
The next is immersion and advocacy.
Immersion, like going native.
Well, maybe not quite, but definitely getting deep into the mHealth ecosystem, spending time where the users actually are, understanding their world, their pain points firsthand.
Seeing it through their eyes.
Yes. And then critically, you need to identify what the study calls post-design advocates.
Post-design advocates, what are they?
These are your champions, people from the different groups involved, patients, clinicians, maybe administrators, who will help push the system forward after the design work is done. They help with implementation. They support it long term.
So they keep the momentum going.
Exactly.
Right.
The study says they're the people behind it that are going to drive, push, and refer patients or their communities to the mHealth system. They're essential for making sure it actually sticks.
Built-in evangelists. I like that. Okay, so understand the people, immerse yourself, find advocates. What's the third area?
The final and really critical area is rigor and relevance.
Rigor and relevance. Tell me more.
This means you have to plan for and actually measure health behavior change right from the start. You need experts involved in that.
Because changing health habits is hard.
It's incredibly hard. As one expert put it so well, you are talking about changing behaviors that are there for a reason. They are not just trivial behaviors, they are deeply embedded.
Wow.
So you need that focus. And you also need health-specific ways to evaluate the system. Rigorous methods.
Like clinical trials.
Things like pilot testing, yes, and even randomized controlled trials like you'd use for a new drug. The study stresses that there's more at stake if anything goes wrong in health.
Makes sense. The stakes are higher.
Definitely. And finally, even after it's launched, yes, collect usage data, how many clicks, how long they use it, but you must pair that with qualitative methods.
Talking to people again.
Yes. To understand the why behind the numbers. Why is it having an impact or why isn't it? You need that deeper story.
Okay, so bringing this all together, what's the main message here for you, our listener?
I think it really boils down to this. Creating a health that truly works isn't just a tech challenge.
It's deeply human.
Deeply human. It's about understanding behavior, building trust, and meticulously planning for how this thing fits into the real world right from day one.
It's making sure these tools don't just, sit on a server somewhere, but actually weave into people's lives, into the health system itself.
Exactly. Moving from just a design on paper to something that creates measurable, positive health changes.
So for you, listening, it really highlights this incredible interplay between technology and humanity when we're trying to solve these big health challenges. And maybe it prompts a question. How could these ideas, the co-design, the focus on implementation, the advocacy, apply to other complex human-centered problems you might face in your own work or life?